Hello, this is the American Medical Association's COVID-19 update. Today we're talking to Eli Kustin, a 13-year-old from Evanston, Illinois, who's helping people in need schedule their vaccine appointments. His mom, Hillary, is joining us today as well. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Eli, I read a story about you in the Washington Post a few weeks ago, and it really resonated with me. I tried to help my mom, who's 86 years old, get scheduled for a vaccination. It was hard enough to do one person, and I kind of hung it up after that. But you have been helping a lot more people, and I'm interested to hear your story. How did you get started with this?
At first, my grandparents were looking for the COVID vaccine appointment, and eventually, this was before I had created ilvaccine.org. So I was just kept checking Jewel Osco, and eventually an appointment came up and I was able to reserve it for them. But I realized that there were so many other people that didn't have somebody that could look for them and that were having issues getting the appointments. So that I helped some other friends of my grandparents. But from there, I realized that there were only so many people I could help. So that's why I created ilvaccine.org, which is an appointment aggregator and availability list so it'll have the location name as well as the address, website, and if there are appointments and who they are for.
Well, let's talk a little bit first before we get into the site. What are you hearing from your grandparents and from their friends that you're helping? How does this whole process feel?
I mean, it feels like it was not well planned out. It could have been more planned out by the federal government, I think, just so that it would be a smoother process for people to get the appointments.
You mean so you didn't have to check like 1,000 different websites?
Yep.
That might be nice. Did you ever expect that somebody on the other end might have like someone they know that works at the Washington Post? Did you ever expect this kind of work to get discovered?
I mean, before I created the website, when I was just helping people, I expect any sort of press coverage, and I didn't want it. But I mean, it doesn't hurt. It was not something that crossed my mind that I would be in the Washington Post, though.
So you have kind of before this whole thing started, do you have a tech support business or something that gave you the skill set to be able to build a site like this?
I had built websites for things before. I built one for my bar mitzvah, built one for some family friends. I built her one for something. So, I mean, I had built general, websites before, but nothing with as many visitors as ilvaccine.org.
So yeah, that's pretty sophisticated stuff. You must have run into that situation where you're like, I can't keep helping all these individuals. Where did this kind of idea then come from to build something bigger?
I noticed that there were other states that had similar volunteer-run websites, and some of them. This was, at beginning of February, I think. They were pretty big, not as big as they are now, but I got the inspiration from that, and I did some research and figured out how they were doing it. And I think within a day or two, I had a working prototype, which doesn't look a ton like our current design, but it was a working prototype of the site.
Hillary, you're kind of hearing this in the background. Your son's working on this thing. What are you thinking along the way, and how do you help?
So he's always loved technology, and so the interest in technology is not surprising. He's always wanted to help people and volunteer, so that was not surprising. What really shocked me was sort of his instincts around the equity and access piece of it. He recognized very early that it would be problematic for him to start getting dozens of people contacting him every day. And how would he prioritize them? Because I said, well, there's an Evanston group. I could post something to Facebook if you want to find more people to help. And he said, but if I'm inundated with people, how do I prioritize them? And so that really surprised me, sort of his understanding of the nuances of those issues with equity and access. And, if you have two people in different counties and appointments in between them, how do you decide who gets that appointment if you're that person, helping people find the appointments? And then also the privacy issues. I think he was really sensitive to the fact that people have to give him their information for him to book appointments. And so he had wanted to help teachers, for example, at his school. And we talked about, well, should he tell the principal to let the teachers know that he's available? But then they'd have to give him their birth date, their address, their phone number. And obviously he's trustworthy. He's not going to do anything with it, but that's uncomfortable. And so, between recognizing those issues and his background in technology and programming, I think he settled on the website pretty quickly as a way to handle some of those issues and just reach more people.
That makes a lot of sense. And those weren't issues necessarily that I was thinking of in terms of, beyond the scale part of this. I noticed the message that's at the top of your website discouraging people from kind of going into areas that they don't normally go to get a shot. Where does that sensitivity come from in terms of the equity issues? You reading a lot about that?
I mean, I've read about it. I've heard about, lots of people going to areas they've never been to, especially underserved areas, and people in underserved areas then having trouble to get the vaccine. So this is definitely something that I've been thinking about when I've designed the site and how I'm marketing the site and who I'm reaching out to. This is something I'm considering when I'm doing that. And that's why we're working on, for example, translating it into Spanish is something that we are working on as well, because we want to be able to reach as many people in all areas of the city and surrounding cities as possible.
How are you reaching, your kind of target audience, so to speak, with the word about the site? Is it just kind of spreading organically, friends of friends, reading in the paper? Where is that coming from?
We've been on multiple media outlets, which have helped, and then I think it's in it's in one of the big vaccine hunter Facebook groups in the area. We've posted it there, and other people have posted it, and it's in some of the other spreadsheets and documents that people have created linking to the site, and we're just reaching out to new people and working on new things. Always.
When you reached just yesterday, right, to a publication?
We reached out to a publication on Saturday, as well. Yeah.
So it is a great story, and hopefully the word is getting out about your new site, ilvaccine.org. Can you tell me, how do you do this? Is this all volunteer driven? I've been to the site. I looked at the sites where you're saying they have a vaccine available, or you can make an appointment. How are you kind of keeping this updated, and what kind of obstacles are you running into doing this?
I think we have 12 or 13 volunteers that are just updating data at the moment. Somewhere from 10 to 13 that are just updating data. And then we've also been working on automating certain locations. So I think we've got a lot of locations where every 7 minutes or so, it goes to the site, checks if there's appointments, and updates the data so that it can be less work for volunteers and more accurate. And there's someone we're in contact with. We're working to add more of those locations.
Is that hard to develop integrations with different sites like that? I imagine that's not necessarily the easiest and fastest thing to do. How are you finding that?
It depends on the site. Some of them are easier than others because they're all using different systems. Some are not super complicated. Some are much more complicated.
Are you finding, I notice some of the bigger chains may be more difficult? Are you finding it works better with some and not others?
It all depends. For example, Walgreens actually now, without an account, you can get generalized details on the appointment availability, which is very useful. And I understand that they don't want people to have very specific information about exactly what time slots, and that's restricted with the Walgreens.com account. But what is good is that without an account, you're able to easily put in a zip code and see if any slots exist within 25 miles. So, for example, that's something that we've integrated into the site.
Got it. Are you making any other kind of changes? Anything planned to make it even easier to use?
I've been thinking about what type of other filters we can add, but I'm trying to make sure that I'm keeping in mind that we want it to be simple as well. So we're thinking about different ways that we can publicize, make it easier to use, and to filter locations as well.
That's excellent. Hillary, what kind of feedback are you getting from folks who have been helped by this system?
The feedback's been really, really positive. I had a friend from Texas reach out last week, and it turns out she knew people in 2 different states who'd used his website to get appointments for their parents. And this is a friend who knows Eli really well, but didn't know he was doing this. And as soon as they said, yeah, I think the website was in the paper, she read about it, she said, that's Eli Kustin, so it's great to hear that it's helping so many people. Eli's gotten a lot of messages through the website of people he's helped. There've been lots of posts, in different groups, and those are just the ones we know about. So it's really great to see that it's helping people and actually making a difference.
Eli, anything that you would want to tell physicians out in our audience? Any advice, any thing that you'd like to pass on to them?
Yeah. So first of all, thank you for all you're doing now and throughout the entire pandemic. I know that I'm very grateful, and that almost everyone is very grateful for all the work you've been doing. And then second, I think what would help, I understand that not all of you will have control over this as you're part of a bigger system, but I think what would be helpful is to make sure that your healthcare systems are working with organizations like this in your state, whether that's Illinois or whether that's, working with something like Vaccinate CA in California or something else in another state, just to ensure that there's other sites that are doing this that have thousands of visitors every day. You just want to make sure that the information they're displaying is accurate and that you can work with them. And then also to make sure that your websites, you're providing transparency to a certain degree of who is getting the vaccine. I understand you can't say that if you are 62 and a half, you're going to get your vaccine on, April 25th. You can't say stuff like that. But what you could, something more just like we're vaccinating people 65 and older, right now, and to wait for a scheduling ticket instead of just saying we're doing 1B, but to say, exactly which parts of 1B you're doing and, if you're currently doing them or not, things like that.
Mm-hmm. Has this impacted anything about what you want to do when you're out in the post-school world?
I want to make a positive change on the world.
Well, I'd say you're off to a pretty good start on that already. Thanks so much, Eli, Hillary, for being with us here today. Eli, thanks for this work. It's really amazing to see people making a difference like you're doing right now. That's it for today's COVID-19 update. We'll be back with another segment shortly. For more information about COVID-19, visit ama-assn.org/COVID-19. And if you're in Illinois, Eli, where should they go to check out where they can get a vaccine?
ilvaccine.org.
Awesome. Thanks for joining us today. Please take care.
Thanks for having us.